welcome back. And if you tuned in late today, we are talking about good health and common sense things we can all do to stay healthy for as long as we live. And it really isn't a big deal. Most of it doesn't cost you a lot of money. And I am honored to have Dr. Neerja Arya. I got it right. Okay, and she has a vast experience, and of course her main field is helping senior citizens.
That's my passion.
That's
yes.
your passion. So we've talked about exercise, and we can put that aside. All right, the other lifestyle changes we can make
is stop smoking. Smoking is one of the biggest risk factors for, of course, cancers, especially lung cancer, but also for heart attack and stroke. And so one of the best things you can do for yourself or for your loved one is to stop smoking or encourage someone to stop smoking. Because if you're not smoking but you're living with somebody who is a smoker, you're also at risk for the bad side effects of smoking.
You might as well smoke yourself.
That's correct. So one of the best things we can do for ourselves is to stop smoking, not be in areas where others are smoking, because that can also cause health problems as well. There are a lot of good medications that we have there and programs to stop smoking. There are patches, nicotine patches, and there's also medication pills that you can take as well to stop smoking. And there's tobacco cessation programs. And other things you can do is even just cut back slowly. So I tell people if they're doing a pack of cigarettes a day, to just take one cigarette out and do just 19, usually a pack of cigarettes has 20 cigarettes, cut down to 19 cigarettes a day for a week. Then the second week do 18 cigarettes. So you're slowly weaning yourself off. And even if you can go down to half a pack a day from a pack, that's still better than nothing. Every little bit helps.
Yeah, and if you're in a room with a lot of people that smoke, leave. That's what
correct.
I do.
That's correct.
But and there are programs and there are things people can do in addition to putting on a patch to help them. Because if you're all in one room and everybody's trying to do the same thing, you help each other.
That's correct. There, besides the nicotine patch, the nicotine gums, there are tablets that can help people. One of the pills is Wellbutrin. It's a medication that's used for patients with depression, but it has also been shown to help with people trying to quit smoking, trying to find out what are triggers to start smoking. Some people start smoking when they go out with friends and are with other smokers, so it may be time to get some new friends or have activities.
Or maybe you can help them.
Exactly, or you can help them. Participating in the healthy lifestyle choices of exercise, yoga, meditation, things that can decrease stress levels. A lot of times people are reaching for those cigarettes because they're stressed. So if they can find another mode of decreasing their stress level or anxiety, that could be also helpful to help decrease the smoking. A lot of people smoke because they think that'll help them stay thin, because that has been shown. For some people, they don't eat as much.
When people stop smoking, sometimes, they do put on weight.
That's true. That does happen, but I think that's transient, because if you can move into a more healthy lifestyle of exercise and watching your diet, I think that can be prevented. But not everyone gains a lot of weight.
We have these electronic cigarettes now, and it has been said, I think it's the Wall Street Journal said, the tobacco companies will earn more income and money from the sale of these electronic cigarettes than anything they've ever had in the past. And I think it's shocking. And kids, are attracted to it because it's something new.
It is. The electronic cigarettes, people think they're 100% safe. They're not. There was just something on CNN today about that some of the common, that there's a lot of toxicology or toxicities with what's in the e-cigarettes going on. And they're not 100% safe as well. They are made with a lot of chemicals, and they can also cause a lot of health problems. They're so new out there that we haven't seen the long-standing complications with being on e-cigarettes, but they're not 100% safe. They're still, you're smoking.
Okay, now, those are good advice on two. Now let's talk a little bit about changing the way we eat. Okay? Because there are things we can do every day. And even if we have children at home, changing and putting that kind of food in front of our families as well as ourselves.
Definitely. The typical American diet is a fast food one, and they're showing that a lot of these developing countries are getting the McDonald's, the Burger Kings, the fast food restaurants, though those places are trying to have healthier choices. And we see more of an increase in obesity. I think eating food that's prepared at home, that's healthier, not high in concentrated fats, not having stuff that's as much fried, more fruits and vegetables are good things. Trying to avoid the sodas, those are high level of sugar, and really trying to stay to more basic food, not where it's processed. That can help with having a healthier diet. Trying to avoid the canned foods, especially like canned beans, canned vegetables. Trying to go more for, the beans where they're the raw ones where you prepare yourself, or vegetables that are fresh. These are things that can actually help you have a better, healthier diet.
And of course, this right now, the time of year makes it a lot easier because we have, farmers markets and roadside stands, and there are a lot of places you can get really fresh vegetables and things right now, even easier than in the wintertime.
Definitely. Definitely. This is a great opportunity, especially being here in the South. We have, more farms and things like that to get things all, from the farms. Your local grocery store, great places to get fresh fruit and vegetables.
And we have a variety.
That's true. That's true. And not having such a heavy meat consumption as well. You don't need meat for every single meal in the day. And there are other ways of getting protein as well. Trying to go for organic is helpful as well, especially with some of the dairy products because,
The only, and I will mention, and it's unfortunate, but people with a family, trying to feed a family, when you buy organic, anything, you pay more for the same item. And I wish they could find a way to remedy that.
No, I agree. Even for someone, it is expensive.
I mean, if you're feeding a family.
Absolutely. And, organic is definitely more expensive. So I would say that you have to make choices of what's more important. I would say probably with, your eggs or dairy, things like that, because they have probably higher levels of toxicities, and certain fruits and vegetables tend to collect the pesticides more than others. But, I think at the end of the day, every bit helps, and probably trying to have foods that are not high in fat, and having food that is not fried, cooking in healthier ways, not cooking with butter, certain oils. Things like canola oil tend to be healthier than other types of oils with cooking. So there's if you're not sure for your specific situation, seeing a dietitian or going to some dietary classes, some grocery stores offer them. I know Whole Foods does some things like that. That can be helpful. There are a lot of great resources online as well on how to have a healthier diet. Other things as well of having lower salt. So, someone who has yes.
So put the salt shaker aside.
That's
and
right.
Many people salt their food before they even taste it.
Salt and yes.
I don't understand that.
Salt and also butter as well. They put a lot of butter and salt, and trying to have maybe instead trying to use some spices that won't necessarily increase your blood pressure, how salt would do. Can be helpful as well.
So salt does contribute to high blood pressure.
Yes, having a diet that's high in salt does increase your blood pressure, and that can be a risk factor for the stroke and the heart disease and things like that. So if someone is already having hypertension, you do need to be careful of your salt intake. And there's salt in other things as well that we may not realize, such as the canned food, the potato chips, things like that, the fast food as well. And there are other toxicity.
And in all fairness, some of these fast food places are trying to serve and offer better quality than they did in the past.
Yes, and I do applaud them. I have seen healthier choices and where the dietary content has been available for the public to read, and they do have healthy choices with fresh salads and things like that.
Yeah. So these are things that the experts tell us, and it's never too soon to start. You may say, well, I don't have to worry about that. I'm still young. I don't have to worry about that. But now is when you lay the foundation for what you're going to be at 80.
Absolutely. They've done studies on people in their 20s and 30s and even in their teens, and they already see at that age group where they're starting to have the buildup of fatty deposits in the blood vessels surrounding their heart.
And as a nation, we have an obesity problem.
We do have an obesity problem, and I feel that's probably due to our lifestyle choices. As you had mentioned, I had just come back from a conference, a medical conference in Sweden, and what really amazed me was just seeing the lifestyle differences from the US. And Sweden is famous for their healthy citizens. And I was amazed, I would see even the older population and pregnant women all on bicycles, and people are walking and using public transportation. And not as much fast food restaurants. I didn't see really many well-known fast food restaurants that we have here in the US. It was more healthier eating, just seeing what was on their menus. They had a lot of fresh fruits and vegetables and salads, and the proportions were also more manageable.
Yeah, we have a tendency when you go to a restaurant and order something, it's the plate, there's enough for 3 people.
That's correct.
And I would think they could cut the cost down and give you less food. And I said something to one of the restaurants where I went, and they said if we did that, people would complain.
That's true. Portion control is very key, and I think one thing is, not eating in front of the television is also very helpful, because when people are eating in front of the television, they lose sight of how much they're actually eating. And just, really sitting down and taking time to enjoy your meal and eating slowly, you'll realize that you don't need as much food, and you get filled up a lot quicker. But we just are in a rush society, and we're just gulping our food down and not really taking our time to eat properly and taking that time to slow down. And I'm guilty of it as well. So
I thank you. Bless you for what
thank
you're
you so
doing
much for
in
having
our
me.
community here in the upstate. And she has agreed to come back, and we're going to do a program with her, a special program, and so I'll try to let people know when that is to be. In the meantime, we do have a phone number, 864-365-0260, and I'll keep it here. And wherever you are, we wish you good health, and put those cigarettes down. We'll all be in good shape.